All right, enjoy yourself, Kimberly. All right, today people are on their phones more than ever, or maybe possibly at a computer. Now, if you ever feel a little pain from maybe about here to maybe like around here somewhere, give or take, something might be wrong. Now, I'm not a doctor, but I know someone who is. Dr. James Saucedo with the Methodist Ambulatory and Surgery Hospital is here to join us with more. And you're actually at the Hand Center of San Antonio as well, so you're a little bit of everywhere. So
yeah, a little bit of travel in a week, yeah.
it's okay. You got to be an important man to help people. Now, let's just get straight to it. Now, I know that you treat patients with issues in their fingers and hands, and you know that's more common now than ever.
Right, right. So as a hand surgeon, I have the privilege of taking care of patients from fingertip to elbow. There's actually some hand surgeons that go all the way up to the shoulder, and so hand surgeons become hand surgeons either when they start out as an orthopedic surgeon, a plastic surgeon, and rarely as a general surgeon. But the unique thing about hand surgeons is that you're treating multiple systems, so skin, nerve, vessel, tendon, muscle, bone, and joints. So as a hand surgeon, I focus my attention on fingertip to elbow. So I see folks who may have fallen and broken a wrist or an elbow, someone who may have been carving pumpkins and accidentally cut their hand. They may have caught a tendon and a nerve, and so we can fix those things. But also for patients who may not have had an injury. They may have been overused in their hands. They may develop catching in the finger, so something we call trigger digit, where they wake up in the morning, they can't actually straighten out their finger on their own accord. Or even numbness and tingling in the hands.
You know, I was about to ask that. What are some of the symptoms? You know, you treat a lot of things, and nowadays, like I did mention, you know, people are on their cell phones. I know it's not proven, but what are some of the other side effects that cause maybe something like that?
Yeah. So the cell phone question is one we get very, very often. Back in the day, it used to be called BlackBerry thumb.
Okay.
Now that BlackBerry's sort of taken out, you know, it's not as much in use anymore. It's now referred to as smartphone thumb. It's really hard to know if the incidence is actually increasing with smartphone use. Smartphones have become such a normal part of our lives that it's hard to determine if you didn't have a smartphone, would you still have the same problem? It's a question to me of degree and access. Are we seeing it more because of the smartphone or because we have better access to care? So what I would say is this falls into the category of listen to your body. So if you're someone who sends 100, 200, 300 texts a day and your wrist and thumb are sore, well then gosh, you should probably either use the voice recognition software or back off a little bit. And if you're someone like you and me and maybe sends 25, 50, we're probably not going to experience that as much.
All right, doctor, thank you very much. I'm going to give everybody the information where they can go get some more information and research at. Now, if y'all want any more information, you can go to their website at sahealth.com/physicians, or you can go visit them off of Huebner Road, 9150 Huebner Road, and of course, Methodist Ambulatory Surgery Hospital. You can give them a call at 210-575-0355 for more information. Find them on Facebook, find them on Twitter. They are everywhere. Thank you, doctor, very much. All right, everyone, don't go anywhere.